What is a nurse practitioner? By Lorely Lopez. The nurse practitioner or NP role was first formally described and implemented in outpatient pediatric clinics in the early 1960s. The NP role originated partially in response to a shortage of primary care physicians. As of 2019, there are over 270,000 licensed nurse practitioners in the United States. 87.1% of these NPs are certified in an area of primary care, and 72.6% deliver primary care. So, what is a nurse practitioner? Nurse practitioners are advanced practice registered nurses who possess a master's degree and a board certification in their specialty and provide holistic care to patients through diagnosis and treatment of diseases, as well as through disease prevention and health management. Where can nurse practitioners work? Several misperceptions exist about the nurse practitioner, one of which is that NPs must work under a physician. This is false. In several states, NPs are able to practice independently as a primary and/or specialty care provider in various settings. These settings include clinics, hospitals, emergency rooms, urgent care facilities, nursing homes, public health department, home health, or in private physician or NP practices. There are several practice areas that nurse practitioners may choose to specialize in. The most common NP specialties are adult nurse practitioner, family psychiatric mental health nurse practitioner, adult gerontology nurse practitioner, family nurse practitioner, or pediatric nurse practitioner. What is the role of the nurse practitioner, or what do they do? Nurse practitioners diagnose and treat acute illnesses. They write prescription for medications, order diagnostic tests to aid in diagnosing illnesses, record and examine the medical history, diagnoses, and symptoms of a patient. They communicate how patients can better manage their health. They develop and implement appropriate care plans, and they provide patient education about diseases, prevention, and medications. In conclusion, the job description of the nurse practitioner can be summarized using three terms. They diagnose, treat, and educate. Nurse practitioners are able to work in various health settings, but most work in a primary care setting. NPs may work independently in several states. Some states, however, require that NPs work with the physician oversight. It is important to recognize that nurse practitioners are not medical doctors. Instead, they are advanced practice registered nurses trained to provide the highest quality care to the patients whom they serve.